here.
Interesting.
So I don't know. It certainly is not drainage. Let me see here. Is the ventricle larger in 2018 compared to now? I think there is some enlargement.
They said yes, based on their results. They said
I
it
agree.
is more enlarged, and I did pull it up.
It is large, but at the same time, you're talking 2018 and now the ventricle can get bigger from hydrocephalus ex vacuum.
Mm-hmm. Exactly. Yeah.
Right too, and microvascular.
Mm-hmm.
So let me see here. Yeah, look at this. She has like more microvascular around.
Uh-huh.
And the ventricle are enlarged, clearly larger.
Yeah, I agree with you on that one.
It is enlarged on both sides. It's not just enlarged on the right. It is enlarged on the both sides here. But the question is, are they enlarged because of obstruction of the shunt, or it is because of the microvascular? Look how much is extensive here.
It's a little blurry, but
I think because I mean she has been falling too. Okay, so she's falling. Yes, she has microvascular. That's the risk of falling. But what about if she's falling because the shunt doesn't work and
Did you find the shunt?
We did, yeah.
Oh, I wasn't lying.
No, it's there.
You
had to prove it.
Remembered the shunt. And Doctor.
What was that last part? Neurosurgery for what?
I mean, either neurosurgery to look for it, or there's something called shuntogram.
That's what we had done earlier.
The problem, I'm not going to do shuntogram on her because this is in the cisternogram. You're not going to give a dye from there to go back into the spine. It needs to happen in the peritoneum. Got it?
Mm-hmm.
And this is not. So shuntogram, I don't think it's not a good idea here. So the best thing to do is a neurosurgery consult, see if they think to do something about it. And the reason for the consult, just say frequent fall, and the shunt tip is out of the ventricles.
Yeah.
Shunt tip is out of the ventricles. So
Okay.
I don't know if they want to do something about it. No.
Yeah, I'm gonna reach out to them, and then ultimately she'll be admitted to the hospital, and she'll stay here, and we'll kind of figure out kind of what the next steps are ultimately too.
Honestly, I agree.
Remember me into the hospital.
We're gonna have to bring you in
Why?
because you've been having lots of falls.
Well, the other people said they're going to do something with my catheter. They think if I go in the bathroom too much.
I think she has a UTI. That's what's causing it. Yeah.
Yeah, well, but this is the thing is that even if you're having a UTI, we still have to treat it here and kind of see how you're doing. If I find a UTI and I send you home, you're going to end up falling at home as well. So it's not going to be beneficial for us because it's a risk for you. I don't want you to break a hip or break a leg because then that's going to be much, much worse, okay? I know, I'm sorry.
I'm gonna stay here.
I'm sorry.
Hospital.
I'm sorry.
Last time I was in for a month. No.
Because she hit her head and she had a brain bleed.
Yeah, well, it sounds like...
No, I was broke my back. I was in a long one.
Two of them. She broke her back, 2 bones at 2 separate falls, and she had a brain bleed the time before.
See, we gotta see what's going on. We gotta make you feel safer to go back home, okay?
Oh, the kids don't want me to go home.
No, we don't. We do want you to go home, but we want you to be safe. She lives by herself.
I know. I was gonna come talk to you guys about it earlier. Is that there's no way we're gonna be able to send her home because you live alone. It's not gonna be safe if I send you home. The last thing I want here is that for you to end up having a fall, and then you end up injuring a hip or a leg, and then you're stuck, being bedbound the whole time. All right.
I know, but
It'll be a short stay. It's not going to be like last time, okay? It's going to be a short stay.
Oh, really?
We're going to give you some antibiotics. We're going to have the neurosurgery team come by and see you and see what they recommend. But if everything looks fine, then we're going to treat you if it's a UTI, and we'll get you on your way home. If there's no UTI and neurosurgery is not going to do anything for what's going on and everything looks normal for them, then we'll have the physical therapist come by and see you and the social worker, and we'll have a safe plan for you to go back home.
Oh, what is your name?
Omar, O-M-A-R.
Omar.
Mhm.
M-O-R.
OMAR.
A.
And you like him because he took that neck thing off of you. He's your friend. Now you don't have that neck thing on.
Yeah, I got it right here.
No, it's
Still
off.
hurting you?
Yeah.
Yeah.
She doesn't understand things.
Yeah.
I keep my.
She's very there's a lot of confusion, and she calls people different names all day.
Oh, Dr. Omar, can you put an official time out for Dr. Gilbert?
Of course, yeah. I'll do that right away. I'm gonna order that as well as the ribs and the lidocaine patch.
Okay.
What's that?
Thank you.
Thank you for your help.
Yeah, of course. Thank you very much. I appreciate
It
it.
made it easier.
What?
Okay. Does that kind of make sense?
So you think that the shunt is loose, out of place, is what possibly?
Her shunt is very different. Okay. Normally a shunt will drain from the ventricle down somewhere into the abdomen and just drain freely. Hers is different, where that it looks like it's connected into a different part of her tract of where the fluid in the brain moves. Okay.
Okay.
And so that's what's different and unusual.
Hold on,
It
Mama.
looks like nothing is different from the shunt on all of her head CTs, but where the shunt tip is does not really make sense.
Okay.
Usually it's in the ventricle. Right now it's sitting between the two brain hemispheres.
Okay.
But that's not new. It's not like it wasn't. It's
That's
not
how
like
it's
it was
always been?
shifted. Exactly. It's
Okay.
always been that way. She does. Yeah, exactly. And she does have findings of the ventricles being enlarged.
Okay.
Not huge, where this is, 100% the cause of why she's falling, but a little bit more enlarged than usual. That's concerning for is the shunt actually working properly.
Gotcha.
So neurosurgery has to come by and see and give us their 2 cents of whether or not it's the shunt issue and the enlargement of the ventricles that's something concerning enough to go in and address the shunt,
Okay.
or is this just chronic and that it's just some microvascular disease like what he was saying, where you'll see these changes happen over time just because the vessels that are so small will get affected by old age.
Okay.
So that's the other issue, is that we don't know 100% why the ventricle is a little bit enlarged. I don't have the answers yet for all the other stuff, like a UTI, if her
Yeah.
electrolytes are off,
They
or
gotta come
various
back.
other things. So we still have some more work to do here.
Okay.
But once I have more of that information, I'll come back and chat with you guys for sure.
Wonderful.
So-
Thank you so much
Of
for
course,
this.
yeah.
Thank you, Alice. Thank you, Doctor.
Thank you very
Thank
much.
you.
Bye.
I
Nice
appreciate
meeting you.
Nice meeting you.
Okay. So that's kind of what we're working with now. We'll go from there, but yeah, again, she's not going to be safe to go home.
Yeah,
Okay.
that's my.
Not what?
You're not going to be safe to go home today.
Even if she goes in a rehab, because she has nobody there until she's. If
Well, my shock is, has she ever been in rehab?
yes, she went in rehab when she got the bruised rib, and they sent her home,
Okay.
and that didn't make sense to me, but
When I broke my back.
twice. Yeah.
Well, let's give you some pain control now for the ribs on your left side. We'll make sure that they're not broken, and then we'll tune you up here. All right?
Her main concern right now is she's having really bad neck pain. That's what you keep complaining to me about.
You will give me a room?
At some point, yeah. But
Otherwise,
Alice, is your neck hurting you?
yeah, it hurts every so often. When I hold it one side, a long time.
But when I press over here, it's not hurting
No, it was hurting in the back.
in the back.
Yeah, where
She's
the
not
shunt-
tender over the bones. It's probably that she sprained her neck when she fell.
Okay.
Sounds like, unsure if it was a seizure or not that had caused her to
Okay.
fall.
Nobody could
So.
ever press on the back of my head, ever, because
Right.
the shunt.
Does she seem more confused to you?
Yes. So confused.
This is not her normal, right?
No.
Does she normally drive on her own? Make her
Never.
own
No,
meals?
she hasn't been able to drive since the stroke.
Okay. But
So-
she makes her own meals, dresses herself, bathes herself.
She's been able to dress herself. Bathing has been a problem lately. Walking has deteriorated.
Okay.
What else? She just, it's a lot of confusion. Calling me at 6:30 in the morning the other day, wondering where her care worker is, because she had a doctor appointment. I'm like,
Does she
6:30
use
in
a
the
walker
morning.
or a cane at all?
She usually uses a walker. The
I
one with
have
the
a
wheels.
walker
Yeah.
at home.
Yeah, but
Yeah. Okay.
that's, she can't even do that. Her granddaughter came because they had this umbrella program for care workers,
Uh-huh.
and she said, "Mom, get over here. She's worse than we thought,"
Yeah.
and couldn't lift her up.
Yeah. Okay.
She and
Let me
her
make sure I have
balance
all the
is
words
off,
that
and
he wanted and that I wanted. That way we give you updates on if I have anything else for you.
perfect.
So we talked about the VP shunt. Her head CT doesn't show any obvious thing besides the enlargement of the ventricles, like what we talked about. Her CT of the neck looks fine. No acute injuries there. And then I'm looking at her blood work here. Her valproic acid level is actually a little bit low. So neurology will follow with that.
Is that something neurology has to do with? Okay.
Yeah, because that has to do with with her blood levels, and if they're a little bit low, then they might have to go up on that dose. She was just started on Vimpat, right?
Correct.
Okay.
50 milligrams. I think twice a day is what he did.
Yeah, we're still waiting for the Keppra level.
And then she
Otherwise, her
was
blood count's still
500.
fine.
She was 500 Keppra and went down to 250 Keppra.
Yep. Yeah. All right. Let me put in some more orders here. I mean, otherwise, I'm looking at her blood work. Everything looks reassuring here.
That's good.
No signs of any obvious infection. Did they get a urine sample from her yet?
Not yet. Yeah, they've been in
Is
here
she
several
able
times.
to go on her own, or do we have
They're
to
going to do a cath.
Okay.
Yep.
I think I already put an order in, but I'll make sure. He wanted, and then we'll do rib series on the left side.
The ribs fall was last week, but she refused
Yeah,
to come
I
into
heard
the
about
ER. Yeah, I made her do it this time. And I don't know if she was injured in this fall. She's not really saying.
Sounds like she also vomited earlier.
She did. Yeah, she did. She threw up her breakfast.
I like Dr. Gilbert. He's very nice.
Yeah, we like him. Seems like he cares about her. To schedule this right away, that was nice.
I've never seen have someone come down and chat with us in the room.
That's amazing.
It was very, very nice to have that. All right, so that's the plan for now. Once I have some more info, I'll come back and chat with you, but we kind of already have we already kind of know what we're
Yeah.
moving towards, so.
Yeah.
All right, let me go chat with the nurse for all this stuff, and we'll go from there.
Yeah, maybe the UTI also might be part of the problem too. Is what
Yes,
I never
UTI
knew about
can
that.
Increase the risk of falls, confusion, but also seizures. So
So that could be
the
it too.
answer to everything.
That'd be nice.
And that's the most common cause of altered mental status in our elderly patients. All right, give me a few minutes, all right?
Thank you.
Questions at all?
No, you've been great.
All right,
Appreciate
I'll
you.
come back. Yeah, of course, I'll be back. Nice to meet you. I'll be back.
Okay, thank you.
You're more than welcome. No problem.
Okay.